Today, we'll review the basic functions and the workflow of the Welch Allyn Connex spot monitor from Baxter. We'll cover how to navigate the device interface and take a set of patient vital signs. The Connex spot monitor, or CSM for short, is a multi-parameter patient monitoring device that can measure non-invasive blood pressure, temperature, SpO2, and pulse rate on adult, pediatric, and neonatal patients. The device comes standard with our SureBP non-invasive blood pressure technology, which measures the patient's BP on the inflation of the cuff. It can also be configured with different temperature and pulse oximetry options. Temperature options include oral, axillary, and rectal with the Welch Allyn SureTemp Plus, or tympanic with the Braun Pro 6000. Pulse oximetry can be configured to accept sensors from either Nonin, Nellcor, or Masimo. Now let's review the physical device and the software user interface. To power on the device, push and hold the blue button on the lower left side of the device face. Once you do that, a small light immediately above the power button will flicker, and the splash screen will appear as the device undergoes its boot up process. The light above the power button will glow green when the device is fully charged and/or amber when charging. If the device is already on but in sleep mode, it can be reactivated by just touching the screen. The Connex Spot Monitor contains 3 profiles to acquire patient vital signs: spot, office, and intervals. However, we'll focus on the office profile as that is the most common for outpatient offices. To navigate between the profiles, select the profile icon at the top right of the screen. Select the desired profile and then click the Home tab. Now let's walk through the different sections of the device screen. You'll see that the interface is broken up into 3 main areas: the status area, content area, and navigation area. The device status area on the top contains a clock and battery status indicator and profile screen selection button. This section is also where any visual alarms and device messages will be displayed. The content area, or the middle portion of the screen, is where your clinical parameters and custom modifiers reside in a tiled format, each with their own unique color. You will see Clear and Save buttons here as well. Clear will delete the current readings on the screen without saving them, and Save will also clear the screen, but to save the measurements into the Review tab for future reference. Lastly, the bottom section of the screen is referred to as the navigation area. This contains tabs that allow you to gain access to patient data as well as advanced clinical and administrative settings. Now that we've reviewed the basic layout of the user interface, let's spend time discussing clinical technique and how to use the equipment properly to support an accurate measurement. In the office profile, users can take a single measurement of each parameter, such as blood pressure, temperature, SpO2, and pulse rate, in addition to running a blood pressure averaging protocol and capturing height and weight to calculate body mass index. Now let's walk through the basics of capturing height, weight, and vitals on this device. Before taking any measurements, it's important to select the proper patient type at the bottom center of the home screen. You can toggle from adult to pediatric to neonate by simply pressing the patient profile button. The age ranges for these patient types are neonate, fewer than 28 days, pediatric, 29 days through 12 years, and adults, greater than 12 years of age. Based on the age of the patient, the proper cuff and blood pressure hose may change. Consult your instructions for use manual for further details. Adjusting this button will alter some of the clinical parameter thresholds, such as maximum inflation rate of the blood pressure cuff. Once you've verified the patient type, you can continue with your measurements. To take a blood pressure, use the range indicator on the cuff to determine the proper size. If 2 cuff sizes fit the patient, use the larger of them. Make sure to place the cuff on the bare upper arm, aligning the cuff marker to the brachial artery. Apply the cuff snugly, allowing room for no more than 2 fingers. The patient's upper arm should be kept at heart level, Both you and the patient should not be talking. Both the patient's back and feet should be supported, their legs uncrossed, and the patient should have an empty bladder. Once the patient is fully situated and the cuff is applied, press the Start button on the NIBP tile to initiate a singular reading. The cuff will inflate with the Sure BP algorithm and capture a measurement on inflation. If the device detects motion or artifact, it may default to step deflation in an effort to obtain a reading. To take an oral temperature measurement, place the probe with probe cover in the sublingual pocket of the mouth. The sublingual pocket is located beneath the tongue on the inside of the gums in the back. Once the probe is properly placed, the thermometer will cycle, and once it's complete, the device will beep. Dispose of the probe cover and set the probe back into the probe well. The SureTemp Plus technology in our temperature probe contains a preheated filament that reduces the time to take a reading by bringing the probe to body temperature prior to measurement. The SureTemp thermometer can also be used to obtain axillary and rectal temperatures. For rectal temperature measurements, a different probe and probe well is required. To switch between these measurement methods, there is an icon within the temperature tile. When pressed, it will change between oral, pediatric axillary for ages 17 and under, and adult axillary mode. Please note that rectal mode can only be accessed if the appropriate probe and probe well are attached to the monitor. Once connected, the rectal icon will appear automatically. To distinguish between oral and axillary thermometers, refer to the color. Blue is for oral and axillary measurement. Red is for rectal. The Connex Spot Monitor also offers tympanic measurement capability if the unit is purchased with an integrated Braun Pro 6000 ear thermometer. To take a measurement, begin by removing the ear thermometer from the dock and attaching a probe cover. Wait for the ready beep and 3 dashes to appear on the thermometer display. Fit the probe snugly into the ear canal and then push and release the measure button. When the thermometer detects an accurate measurement, the exact temp light is continuously on. A long beep signals the end of the measurement and the display shows the result. Eject the probe cover and place the thermometer back in the dock to transfer the reading to the CSM device. Next is pulse oximetry. To achieve a proper SpO2 measurement, make sure you have the right size sensor for the patient. Use a clean, dry site where the sensor will be placed. Heavy lotions, sunscreen, dirt, oils, and nail polish may alter its accuracy or secure placement of the sensor. To ensure proper placement of the sensor, it is recommended to use the index, middle, or ring finger, toe, or foot. Once the sensor is placed, if signal quality is low, check for the following conditions: sensor position and size to ensure good fit, connection to the monitor, and if the skin is warm and has good blood flow. You can also select a different finger or location for measurement. If capturing a height and weight, you may manually enter the values by pressing and holding the tile and then using the numeric keypad or the arrows to fill in the appropriate number. The CSM also interfaces with some third-party scale manufacturers for direct transfer of the patient's height and weight if desired. Now that the patient's vitals have been captured, the clinician can document them manually in the chart and hit the Save button. Finally, let's review the blood pressure averaging capability on the Connex Spot Monitor. To start blood pressure averaging, select the clock on the within the NIBP tile. Then select the averaging program, which can be customized in advanced settings, and push the Start Intervals button. The device will then run through its averaging protocol and present the clinician with the averaged reading on the NIBP tile. The CSM can support the creation of 6 custom averaging protocols, and each can do up to 6 readings. You can also customize a delay to start, the time in between readings, and reading discards for those that are under or over the thresholds established. Once finished with patient care, turn the CSM off or put it into sleep mode by pressing the power button and select the relevant option from the on-screen menu. And thank you for watching our in-service training on the Connex Spot Monitor for outpatient care. If you have any additional questions, please reach out to your local Baxter representative for more information.